The recent research exploring the potential of Mifepristone, a drug known primarily for its role in terminating early pregnancies, to extend lifespan through improved mitophagy is both intriguing and troubling. While the idea of using an already approved drug for anti-aging purposes may sound promising, there are significant concerns about the broader implications of such findings, especially when considering the broader, long-term consequences for public health and ethical concerns surrounding the use of the drug. Mifepristone has long been used for medical purposes related to abortion and other conditions like Cushing's disease and certain cancers. However, the new research coming out of USC Dornsife College presents an entirely different use for the drug, suggesting it may also play a role in extending lifespan by promoting mitophagy. This is the process by which cells clear damaged mitochondria, a crucial aspect of cellular health. Mitochondria are the powerhouse of the cell, and when they malfunction, it can lead to various health issues, including age-related diseases. Enhancing mitophagy has been proposed as a way to counteract the cellular decline associated with aging. While this might seem like a revolutionary discovery, there are several issues that should cause significant concern. First and foremost, the research has so far been conducted in fruit flies, and while fruit fly studies have provided insights into aging mechanisms, there is no guarantee that the same results will apply to humans. The potential for Mifepristone to safely and effectively enhance mitophagy in humans remains unproven, and any premature optimism about its capabilities could lead to misguided clinical trials and poorly understood health risks. One of the most troubling aspects of this research is the potential for Mifepristone to be repurposed for a purpose that was never intended when the drug was originally approved. The drug's approval and use in contexts like pregnancy termination have already sparked intense political and ethical debates, particularly in the United States. Introducing Mifepristone into the realm of anti-aging therapies only risks further politicizing its use and could turn a medical treatment that has already been fraught with controversy into a tool for profit-driven pharmaceutical companies. Repurposing a drug like Mifepristone for anti-aging raises significant ethical questions. Should we be using powerful medications to prolong life, especially when the long-term consequences of such interventions are unknown? The idea of extending lifespan through drugs is not new, but it brings with it moral quandaries about who has access to these therapies and whether the societal focus should shift toward ensuring better quality of life rather than just prolonging life. Anti-aging therapies, by their very nature, tend to emphasize a very specific segment of the population, the elderly, who might be seen as the primary beneficiaries of such treatments. But at what cost to other public health priorities? Moreover, the potential risks of such treatments are being glossed over in the excitement surrounding the findings. While Mifepristone may have demonstrated benefits in fruit flies, the reality is that extending lifespan in humans is an incredibly complex challenge. Intervening in cellular processes to improve mitophagy might have unintended consequences, including the possibility of encouraging the growth of abnormal cells, increasing cancer risks, or triggering unforeseen health complications that have not yet been studied. Mifepristone is not without its own set of side effects, including potential complications in women, particularly when used in inappropriate contexts or dosages. Using it as an anti-aging drug could expose individuals to new risks that far outweigh the possible benefits. Additionally, there is the problem of the drug's availability and accessibility. Anti-aging treatments are often marketed as miracle cures to an aging population desperate for answers, but these therapies often come with hefty price tags that make them inaccessible to the average person. If Mifepristone is repurposed for this purpose, it could lead to a scenario where only the wealthiest individuals have access to what is seen as an essential life-extending drug, further exacerbating social inequality. The rich could prolong their lives, while the majority of the population remains at the mercy of a healthcare system that is already financially strained and inequitable. The political and social ramifications of treating aging as a medical condition to be solved by pharmaceutical intervention are also worth considering. In a society where health outcomes are already deeply influenced by socioeconomic status, introducing anti-aging therapies into the marketplace could widen the gap between the haves and the have-nots. It could also contribute to the narrative that aging, something natural and inevitable, is a condition that needs to be fixed, potentially leading to unrealistic expectations about the nature of aging and life itself. In conclusion, While the discovery of Mifepristone's potential to extend lifespan by improving mitophagy might seem like a breakthrough, it comes with a host of unresolved concerns. These include questions about safety, efficacy, ethics, and accessibility. Moreover, by politicizing the use of drugs like mifepristone in the pursuit of anti-aging therapies, we risk oversimplifying the complex realities of aging and health while potentially exposing individuals to harmful consequences. The focus should be on improving overall health and quality of life rather than chasing a goal that may not be achievable or desirable for everyone. The excitement around such findings should be tempered with a healthy dose of skepticism, and future research should proceed with caution to ensure that we don't repeat past mistakes in the rush to find a miracle cure.